Hello guys, in this video we will be discussing about the most important topic of the pathology, that is amyloidosis. So let's get started. Let me tell the definition of amyloidosis. Actually, it is a pathological state which is associated with inherited and inflammatory disorders, which is and the amyloid is responsible for tissue damage and functional compromise So let me give the roadmap of actually what we are going to discuss in this video. So the first topic we will be discussing, that will be its property. Then we will be discussing its classification. Then the most important part, that will be the diagnosis. And the last, which will be our organ involvement. So let's get started with the first point, that is property. We classify the property into physical and chemical. In the physical, we include actually how the amyloid will be visible, that will on the electron microscope and on the X-ray crystallography. Under the electron microscope, it will be visible non-branching fibril of indefinite length. And the most important MCQ point of view, that is its length, which is 7.5 to 10 nanometer in diameter. In diameter. And the next, that was our X-ray crystallography. In the X-ray crystallography, the appearance of amyloid will be cross beta plated sheath. This is the most important point on basis of MCQ sheath. Now next we will be discussing its chemical property. Actually, the amyloidosis has two structures. That will be its fibrillar protein, and the second will be P component, that is the precursor molecule, precursor part. The fibrillar protein, that will be 95%, whereas the precursor component, that will be of the 5%. Now let us discuss its classification. On the basis of three ways we will classify it, that is localized, then generalized And the third one, that will be the hereditary. So let's get started with the first, that is the localized. Under the localized, it involves the endocrine system. The associated disease with the endocrine, that is the medullary carcinoma. Medullary carcinoma of thyroid. And the precursor molecule of it, that is the calcitonin. Hence the major fibril protein, that will be ACAL. This is the most important point to be remembered. The next involvement, that is our cerebral. And the disease associated with the cerebral, that is the Alzheimer's disease. And the major fibril protein, that will be A beta. So this is to be remembered, A beta. Now the third part, that is isolated atrial amyloidosis. And the major fibril protein, that will be our ANF. Here the ANF, that is the atrial natriuretic factor. Now let us move on to the another part, that is our second, systemic. Systemic is also called the generalized. It includes first, that is the primary amyloidosis. Actually, the primary amyloidosis, that is the associated disease, that is the multiple myeloma. Actually, this is the, let me just suggest, actually it is the light chain, Ig light chain amyloidosis type. And here in the multiple myeloma, the major protein, that is the AL. Here the L denotes the light chain. Now the second in it, that will be second, that is our secondary amyloidosis. And the associated disease with it, that is the chronic inflammatory disorder or the condition. Actually, as we know, in the chronic inflammation, there is the release of the cytokines, then interleukins, that is 1 and the 6, and after the bypass of the liver, that is the final protein, precursor protein, that is the SAA. Actually, that is serum amyloid protein, serum amyloid associated precursor molecule. Hence, the major fibrillar component here, it will be A. This is to be remembered, AA, and here A is associated, amyloid associated. The third one, that is the hemodialysis associated. The associated disease with it, that is the chronic renal failure. And the major fibrillar protein, that is the A beta 2M. Here the A beta 2M denotes microglobulin. The third one means the most important classification, that is the third type, that is the hereditary amyloidosis. Actually, it includes the familial type, FAMILAL, familial type. It has the further familial type has two more types. Let us discuss that. The first includes the Mediterranean. And the second one, that includes the amyloidotic neuropathies. Actually, the Mediterranean is same. It is same as the above. That is the protein involved. Is the serum amyloid associated. Hence, the major fibrillar part, that will be AA, same as above. And in these amyloid neuropathies, it will be the mutant, the protein, the precursor protein, that is the mutant transthyretin, TRANSTHYRETIN. So, as we know, the transthyretin is involved in the transport of thyroxine and the retinol. Hence, the major fibrillar part here will be ATTR. A is the amyloid, TTR is the transthyretin part. The third one and the last one, that is the third type of the hereditary amyloidosis, that is the adult type, ADULT. Adult, or we can say senile. Here also the precursor protein is the transthyretin. But the differences between the here transthyretin and the transthyretin involved in the amyloidosis neuropathies is the transthyretin involved in the neuropathies, that will be the mutated, and here in the adult, that will be simple normal transthyretin. Hence, the major fibrillar part, that is ATTR. This to be remembered. Hence, we have completed our two major parts, that is the property and its classification. In the next part of this video, we will be discussing about the diagnosis, which is the most important part, and the fourth, that is the organ involvement.